Hello, my name's Michelle, and I this week researched attention deficit hyperactivity disorder, or ADHD, for my unfamiliar diagnosis. So ADHD is a disorder that is a neurodevelopmental mental health condition in childhood, and it's characterized by developmentally inappropriate levels of inattention, distractibility, and hyperactivity. So there's a couple of different things, and the viewpoints on ADHD are very different because people have created stigmas and ideas of what they are. So there are what ADHD is, and there are what ADHD is not. So it really breaks down what it is and really the impact that it does have overall because of the negative stigmas. There are lots of different characteristics, and there are three different types. So there's the inattention, the hyperactivity, and then there's the combination. So when they do the identification, you can be one or the other or both. So here's a list of a lot of the different things that you would see within each of those areas. ADHD has many strengths, and it should be looked at and viewed as a strength-based. There are many things such as individuals have high energy levels, they're more self-aware, they have that self-awareness that they're able to kind of tap into, they're resilient, being able to self-soothe and self-regulate, and they're able just to kind of be able to identify themselves a little bit more in their needs. They also have strengths within the school. They're being creative, and it's really important for teachers to allow that creativity and opportunities for that. They also have a hyperfocus at times where they can find a topic that interests them and really stick with it and follow through on that. And they have a risk tolerance. So exhibiting that they are sometimes adventurous and teachers should encourage them to explore. Some of the challenges that are seen are the struggles within the classroom with academic difficulties and judgment from peers. There's the experiences more accidents and injuries because they are sometimes more compulsive with their decisions. Sometimes they have lower self-esteem. They face difficulties in interacting and being accepted by others. And then later in life, there is a risk for alcohol and drug abuse. The prevalence right now, it is 8 to 15% of school-age kids. There has been an increase of this, but they are thinking that it's not that there's an increase of ADHD, but there is more awareness around ADHD, and also there's more testing available. They have, in the United States, we are seeing a lower rate for Hispanic and African American children. And for the school-age children, they range from about 2 to 5.7% with clinical diagnosis. There's no determining factor of what is causing or what causes ADHD, but what they are finding is there's brain function and structure. ADHD runs within families, and they're more prevalent if you are seeing that within the families. And then there are groups that are higher risk with individuals such as individuals that were born prematurely, that have epilepsy, or that have experienced brain damage in the womb, or from a severe head injury. So there is also coexisting conditions that you see with ADHD. Oppositional and conduct disorders are one, learning disabilities or disorders, mood and anxiety disorders, and you see tic disorders, and those are more common with the ADHD. With the evaluation, because ADHD is a neurobehavioral syndrome, there is no medical testing to truly define or outline that someone has ADHD. So they have to rely on the symptoms, and they rule out potential causes, and they also have to rule out other disabilities or things that may be impacting. So it's really important for them to see the whole picture and break it down fully. And when they do there's an assessment called the DSM-5, and this is for the mental disorders. They use that, and within that, in order to qualify for ADHD, you would have 6 or more symptoms in the inattentive or hyperactivity range. And this is up to age 16. And if you're over 16, it would be only 5. You would only need 5 of those areas. But they use a lot of the interviews from parents and guardians, and rating skills, and a lot of different resources. So that's a lot of time making sure that they put into it to get a full picture of the individual. There are some treatment options. One is medication. There are different stimulants and non-stimulants that can be used. Behavioral therapy and cognitive behavioral therapy is a very valuable and essential tool that can help ADHD. Parent education and support, and then school-based programs. In the schools, there's evidence-based practices, and there's quite a few that help support students with ADHD. So providing structure and predictability, positive behavior supports is a really beneficial one for them to use, and expert consultations. So using psychologists and other people that come in and provides training and support for staff. More evidence-based practices are teachers being able to adapt their routines for students who have ADHD. Positive reinforcement strategies, really focusing on the positive desired behaviors. Many of the students with ADHD are familiar with hearing the negative and what they're doing wrong, so it's really important to have that positive reinforcement. Daily report cards are very beneficial as well and help connect the families. And then token economy systems work with students and also need to be used with specific students in order to meet specific needs. Here's a list of some of the accommodations and just accommodation ideas that could be used for IEPs or 504s. And it's broken down into classroom accommodations, test taking, working accommodations, classroom accommodations, and then other accommodations. And again, this is just some ideas. Some supports that can be used at home to support children with ADHD are sticking to a routine, eating regular, healthy meals, using homework and notebook organizers to write down assessments and reminders, getting plenty of sleep, get regular exercise, especially when hyperactive or restless, and then taking medications as directed. Another important part is advocating for children with ADHD, and this is tips for teachers and family members working together, building collaborative family member and teacher relationships, and then connecting all parties, making sure that everyone is involved with the 504 process and IEP meetings, using the data to drive the interventions and the instructions, using email as a written form of communication to keep records, understanding that a student's disability may impact a family member and teachers, and then focusing on the teaching skills and ensuring equal opportunities rather than expecting perfection from students with ADHD. Some tips for parents at home is make sure to listen to the concerns and validate the feelings without judgment, and helping children express their success frequently, ensure that they know that they are loved unconditionally, address fears and anxieties, and then teach children to advocate for themselves early on. Here are some other resources. The CDC has some great tips and other resources for teachers and family members. The Chad also has great benefits or great information for parents as well as teachers. And then the Child Mind Institution has some information for teachers as far as how to support students when in their classrooms that have ADHD. Here are the resources that were used. Thank you so much.